There's a lot of information on the web right now about patients stretching out or damaging their sleeve or their gastric bypass with too much fluid at one time. And from the patient perspective, unfortunately, it's credible because every patient has had a situation where they've had a bit too much fluid at one time or taken one too many swallows too quickly, and it hurts. And so the concern is naturally going to come up, well, did I cause damage? Did I cause stretching or something along those lines? And my name is John Pilcher. I'm a bariatric surgeon in San Antonio, and I hope I can relieve some of these concerns for you. Now, I want to clarify that I'm talking about fluids, water and broth and these kinds of things. I'm not talking about solid food, and solid food at the wrong time can cause damage to your pouch, and I'm aware of situations where it's actually caused a leak. And so I want to be really clear that you should not go into solid food until you have clearance from your surgical team. In fact, I want to emphasize that regardless of what I say on this video, you should follow the instructions of your surgical team. But as far as fluids go, it's natural for the sleeve and the gastric bypass to be a little bit resistant in the first several weeks after the surgery. It's very common for people to feel a bit of discomfort here, or maybe even a little bit further down as they drink. And this sense of discomfort or resistance is coming from the fact, as I believe it, of the fluids not traveling very quickly, and the place where the fluids are backing up, where we didn't even operate, the place where the fluids are backing up is the place that you feel this excessive distension or discomfort. But there's not harm involved, and water, being a fluid, is very able to escape if there's an overpressure situation. The best way for it to escape is for the patient to regurgitate or throw up, although I say best. I hope you don't regurgitate or throw up. But the water is also able to travel downstream even while all this is happening, even while the discomfort is taking place. So in the absence of an obstruction, which is another complication, the fluids are going to find a safe way away from that pressure situation. And so first of all, I don't think that drinking too fast or drinking too much actually can cause a leak. Maybe if someone tried really hard, that would be possible, but not by accident, not what patients typically do, trying to follow directions. And in the long run, I'm very confident that drinking water and drinking fluids does not lead to pouch stretching, either for the sleeve or the gastric bypass. There's just not enough pressure to be able to cause that stretching. Of course, one type of fluids that's especially likely to cause trouble in the first couple of weeks is carbonated fluid. And the most common carbonated fluids are sodas, which we don't want you to have anyway because they're full of chemicals and a bunch of metabolically adverse materials. Even carbonated water in the first couple of weeks is going to tend to fizz up inside your stomach, expand rapidly, and cause significant discomfort. So I think that they are to be avoided because of the discomfort piece. I'm not worried that even these carbonated fluids will cause leaks, but most surgical programs recommend long-term avoidance, and I am supportive of that, definitely in the first several weeks. In the long run, I think fizzy water or carbonated water can be okay. I'm always against sodas, whether they're real or fake sugar. And I'll bring food back into it. Even food, I think in the long run, I'm talking 3 months, 6 months, 3 years later on, you have to try really hard with food to cause stretching of your gastric sleeve or your gastric pouch. And I think it's important to help people relieve about this because hydration is so important. And I want you to drink fluids regularly. And if you happen to take an extra swallow, just let that settle down, give it a little bit of a rest, and then you should be able to go back to hydrating in a normal way. So that's this quick little video. I hope I've given you some peace of mind. I would welcome some feedback in your comments. And thank you.